So, Dr. Wayne Jonas, welcome to the Plant Yourself podcast.
Thank you very much. It's great to be here, really enjoy your podcasts and so glad to be on it.
Awesome. So I would love, so we're going to be talking about healing, which is unfortunately quite different from what I usually talk about, which is healthcare. And so, go ahead.
There's a big difference between healthcare and healing, and we need to get our healthcare system focused more on healing and the creation of well-being. That's sort of what it ought to be doing, in my opinion.
Yeah, and your opinion is backed by decades of research and practice and leadership. And I wonder if you could just kind of give us the thumbnail of your career and what brings you to the work you're doing now.
No, sure. I mean, it's been a long career and a lot of lessons that I learned, mostly from my patients, but also from having been in fortunate positions to be able to examine the world healing traditions from the NIH, from the World Health Organization centers that I ran, from the Office of Alternative Medicine that I ran for a number of years, and also from the perspective of a mainstream provider. I was trained as a conventional Western doctor, and I became a family physician. I practiced in the military for over 20 years. And part of that time I spent doing research at Walter Reed and teaching research, and really had the opportunity to take a look through the scientific lens and through my own practice. What were the components of healing traditions, including the Western tradition, Ayurveda, Chinese medicine, complementary and alternative medicine, through a scientific lens. And really examining and carefully working with patients really taught me what are the components that really cut across all of those systems that are the fundamental things that facilitate healing and well-being. And that's what the book is about. It's about those lessons learned and how you can apply that today.
Great. So a couple of lines really jumped out at me. One of them on page 197 is that the healthcare system is a triple oxymoron. So yeah. You say it produces only about 20% of the public's health. It is difficult for those working in it to deliver it compassionate care, and it is not an integrated system. No health, no care, not a system. So can we go over each of those? 'Cause I think a lot of the book is about the fact that our healthcare modalities produce about 20 to 30% of the healing, and something else is responsible for the rest of the 70 to 80% when it occurs. So let's go through, because that's a pretty bold statement.
Yeah, well, unfortunately, it's true, and in the U.S., it's getting more true, actually, as the healthcare costs go up, as our healthcare outcomes go down, which have been documented, including our life expectancy, which over the last 2 years has actually declined after having gone up for 80 years after that. And most people who get ill and actually enter into the system are not very satisfied with it. It doesn't seem to care for them very well. It sort of is running its own business and not doing that. And that's why I say it's a triple oxymoron. The data is very clear. It's been published by National Academy of Medicine, Robert Wood Johnson, multiple other studies, that the healthcare, we have a pathology system. We have a treatment system that waits till you get sick, and then it throws a lot of expensive interventions at you. And those interventions are essential when you're sick and you're close to dying, or if you have an accident or an infection or cancer or something like that, a heart attack, they can save your life, no question about it. And yet we now know that many of those conditions are preventable. Many of them are even reversible. Chronic illnesses are reversible, but we have a system that's set up to wait until you get them. And then throw interventions at them. I learned from the textbook of pathology when I was in medical school, and I learned something called pathogenesis, which means the creation, the genesis of pathology. And my job was to stop that, right? Well, the flip side of that is salutogenesis. And I use that word in my book. Saluto is health. Genesis is the creation of health. And we need a healthcare system that not only, saves us when we're having a heart attack, but also then does the things necessary to prevent and reverse the underlying processes that led to that.
Right. So a lot of the stories in the book are not prevention stories, right? They're stories of people who are seeking healing of one sort or another, and how what brings them healing isn't what's typically in the medical toolkit. That there's other things, and it's not there's no one formula for healing. Can you talk about kind of some of the work you've done and some of the, like one thing I got from your book, unfortunately, was a reading list of like 30 other books I had to read. So you should get an Amazon commission for the number of books I've gone to buy since reading your book. But there's this huge literature on healing as something separate from simply the drugs and the surgeries and the procedures that Western medicine does.
Yeah, even the origins of Western medicine know this. I describe how Hippocrates actually sort of understood the fundamental processes of healing and implemented that and trained doctors at doing that, as well as other traditional systems from around the country. Even though there's a variety of approaches, there is a standard process that occurs that I describe. We know, for example, that health comes when you're living in a healthy environment. So I talk about the physical environment and the importance of light, exposure to nature, fresh air, clean water, those types of things. We know those things are key parts of keeping healthy and even recovery. We know, for example, that 60 to 70% of the chronic diseases that we suffer today are lifestyle based. They have to do with 4 simple things: diet, sleep, exercise, how you move, and stress in those areas. We know that the ability to actually implement those kinds of healthy behaviors is dependent upon 2 things. Number one, it's the social and emotional environment you're in, your family, your friends, the loves, the fears, and how you manage those. And then finally, the mental and spiritual components. Why are you here? What do you live for? Are your health behaviors and is your health care aligned with your life goals? And when you can get all of those lined up, you can find the pathway in to your own healing journey, even if you're fairly far along. I write about a number of patients that I've had over the many years who have had, for example, 10 years of chronic pain, multiple treatments, surgeries, injections, medications, etc., who, when they were able to identify sort of why they wanted to improve their pain, what they lived for in their life on a sort of a mental and a social and emotional level and a family level, they were able to actually start their healing journey and get back and recover their health and improve their pain.
Yeah. So one, like in the beginning of the book, you talk about placebo, and like there's been I think in the last 30 or 40 years, a real evolution of how we think about placebo, where, in the late 40s, when they had the first randomized trials, placebo was the thing that you had to try to eliminate to find the truth. Then it became, okay, well, we are gullible and we believe anything, and you can fool us with the size of the pill or the color of the pill or the belief of the practitioner. So let's use that. But you approach placebo in a very different way. I think sort of informed by Ted Kapchuk at Harvard. You kind of take the stigma out of placebo. Like, I'm not gullible for believing it, but you're putting it in some bigger, more noble human context. Can you talk about that?
Yeah, I think there's a huge knowledge base that comes out of research in which placebos have been used, or which have been looked at the underlying mechanisms behind what's called a placebo effect. And Dan Moorman and I from the University of Michigan years ago, and I reiterate this in the book, I think we should stop using that word. Actually, it's a misleading word, the placebo effect, because it doesn't call it what it is. What it is the meaning and context effect. It's actually the healing effect that occurs from the meaning that we have in what we do and the context, the surrounding of how we do it, the rituals that occur that induce an inner healing response that is inherent in all of us. And now we know, when we begin to look at it that way, that what is called the placebo effect, which has been used to sort of determine, to say the things that happen instead of the chemical, right? And those are actually the bulk of what happens in healing. Actually, it's one reason why it's so hard to get a new drug on the market and costs billions of dollars, is because you've got to prove your chemical adds that much more healing over the meaning and context effect. That is the ritual process. And we now know that if people have expectations and belief about what they're doing, including the physicians, by the way, not just the patient, if the culture they live in believes in that, and if the rituals that we go through reinforce that inherent healing capacity, you can tap into that in a very, very powerful way. And that's been shown across multiple conditions, across multiple studies. And so we should be harnessing the effect of the meaning and context response and beginning to infuse it in all of our approaches to healing. And we would enhance our healing, and I've seen that in my own practice. We would enhance our healing capacity no matter what methodology or modality that we're using.
Mm-hmm. And there was a study and an anecdote that you share in the book that were really eye-opening to me about this meaning and context effect. Well, the study was, I believe it was dentists who were told whether their patients received a placebo, Naxalone, or painkiller.
Right.
And all the patients received the placebo, but the ones whose dentist believed they received the painkiller reported less pain, even without the dentist telling them.
Now, that's exactly right. I mean, one of the myths about the placebo effect is that it's only about the patient's belief. And that's not true. These studies, there was a couple of them done by the former NIH researcher, the late NIH researcher, Richard Gracely, brilliant investigator. And he wanted to know, well, what influenced the belief and the expectation of the physician, of the provider have on the outcome. So he designed these ingenious experiments in which he would tell the providers, in this case it was dental surgeons, the model they were looking at was pain after you had your wisdom teeth extracted. And he told half of them that their patients might be getting a painkiller. And then he told the other half that they wouldn't be getting a painkiller. They'd be getting either a placebo or something that might actually increase their pain. Naloxone might actually increase your pain because it blocks your own endogenous painkillers. And then, of course, he gave all the patients placebo. He told them not to talk to their patients. It was a study about them, so don't tell them they were involved in a study. But then he measured the pain in the patients, okay? And those in which the oral surgeons believed that their patients could be getting a painkiller had much less pain. So there was an expectation and a belief that the providers had, the physicians had, that then influenced the pain experience and the pain outcomes of the patients. It wasn't about the belief of the patients. The patients thought they were all just getting routine stuff.
Right, and before I get to the anecdote that you tell, which is about your patient who did hyperbaric therapy, but like, to me that can lead to a problem for a physician who wants to tell the truth. That it's almost like, yes, if the more you lie or believe, you know what I'm saying, that if you give a sort of realistic diagnosis or temper the expectations, you're actually reducing the potential meaning and context effect of healing in your patient.
Yes. Well, you can't lie. You shouldn't be lying. That's unethical to do, and it's also damaging because it ruptures trust between the patient and the physician. And it's just unethical to do. You shouldn't be lying to patients. But understanding the placebo effect as the meaning and context effect shows you don't actually have to do that. you can actually tell the patient that we're going to go through this treatment ritual, and if you do that with me, it's likely that it's going to benefit you. This was a question that Ted Kaptchuk actually asked from Harvard that you mentioned earlier. He wanted to know that, well, if you told a person it was a placebo, you said, well, this is an inert pill, okay? There's no therapeutic value in it. But if you do it anyway, it's likely that you'll get better, which the research actually shows. And those studies are called open placebo studies. So they're open, meaning you know it's a placebo, you go through the treatment anyway, and then you look at the effects. And they've now done probably over a dozen of these studies in a variety of conditions, including, serious chronic conditions like low back pain. And they've shown that you can tell somebody that you're going to give them a placebo. You take them through the ritual of the visit and the treatment and the pill and that type of stuff, and it works just as well. If they know or they don't know. It's not just what you think up here. It's the cultural belief, expectation, and meeting that your unconscious and your culture imbues, activates in you. It's that healing response that occurs. And it occurs whether you believe it or not. Now, belief is important. You have to believe it in order to do it, right? And belief does have your conscious belief does have a small effect on that. If you believe a treatment is going to affect, it does work a little bit better. But most of the healing response is embedded in the therapeutic relationship and the interaction that you have during, and the ritual that you go through during treatment. And this is what taps into those unconscious components. I'll give you, go ahead.
Yeah, no, keep going.
Well, I'll give you an example of this. I mean, it gets down to even the specifics of your body knowing which receptors to use. You can actually train your body to use certain receptors. For example, if you give a placebo for pain treatment, the expectation part of it works through your endogenous opioids, because you can block that pain effect with a drug called naloxone, which blocks the endogenous opioids, okay? If you go through a ritual where you're conditioning somebody to pain, let's say you're giving them an opioid for painkiller, or you're giving them something like aspirin for a painkiller, and you repeatedly condition them to do that, the ritual will condition them, just sort of like Pavlov's dogs, to respond to pain. And they use different receptors. If you condition them with the opioid, they will use the opioid receptors, which you can reverse with naloxone. If you condition them with aspirin, they'll use different receptors, the cyclooxygenase receptors, which you can't reverse with naloxone. So you can actually train your body to use specific receptors to produce the same effect, depending upon the ritual and the expectation that it has.
Wow. And this reminds me of a case study you mentioned in the book about, I can't remember the condition, but it was a girl who couldn't tolerate, I think, the immune reducing function of some drug, and so it was paired with the scent of rose.
Yes.
Right. And so just like Pavlov's dog, that instead of salivating when they hear the bell, her immune system does the right thing now when she smells roses, instead of taking the drugs, which had side effects that she couldn't tolerate.
That's right. Yeah, she had a very severe autoimmune disease and was on immunosuppressants to keep her autoimmune disease from acting up, but it produced significant side effects. So the pediatrician was able to actually condition the drug with the scent and the imagination, very interesting, her imagery in her head of a rose with the immunosuppressive drug. Then they were able to reduce the immunosuppressive drug, continue the scent and the imagination of the rose, which continued to produce the immunosuppression but didn't produce the side effects in those areas. It was using a conditioning, which is one of the mechanisms that underlie the placebo response in those areas. So that's an example of utilizing our scientific knowledge about the mechanisms of placebo response to induce healing and train your body to heal. And this girl was so good, pretty soon she could actually induce an immunosuppressive and therapeutic response just by imagining a rose. Okay, so she could use imagery, her own mind, to begin to train her body in those ways. And we do this all the time. We do this with the food that we eat, with the exercise that we do, with how we interpret stresses. in those areas. I write a lot about research of Stanford researcher Elia Crum, who talks about mind over milkshakes. Probably you probably saw that study.
Amazing study.
In which the hormone effects in response to a high-fat or a low-fat milkshake could be modulated by what type of a milkshake you thought it was, even though they were all the same milkshake in those areas. If it was a high-fat milkshake, high-sugar milkshake, it would induce the hormones that suppressed your appetite as if you had eaten a heavy meal, compared to if you thought it was a low-calorie, low-fat, low-sugar milkshake, and you'd be hungrier sooner after that, even though the milkshakes were exactly the same.
Right, which I don't like that, because I'm an advocate for what I see scientifically as the most healthy diet for human beings, a low-fat, whole food, plant-based diet, and yet I can see that because the placebo, or the context and meaning effect, is 70%. That people can get better on lots of diets that they believe are going to make them better. And that people, can all of a sudden decide they have a gluten sensitivity and then have it, except in controlled studies where they don't know if they're getting gluten or not, that it's a lot messier than I would like to believe and that I would like to teach people.
I think you're exactly right. And as you know, there's so much confusion out there about food and about diet and this type of thing. It's why we have diets all the way from, plant-based, low fat diets. I think similar to what you have talked about, all the way to Atkins diet, high fat, high diet, and that kind of stuff. And every between, they all claim they're useful. Now, I think diets are not simply the chemicals in the food. And this is one of the problems. In the West, we keep thinking it's the chemicals that are producing it, right? And so we look at the composition of the food and we think that's it. A friend of mine who used to study the genetic effects of the Mediterranean diet, which is a plant-based vegetable diet, which is probably one of the most evidence-based, using randomized control trials diets for health that's been studied, that he was studying the genetic influences of the Mediterranean diet. So he was looking at what gene expressions were emerging in the urine of people as they went on and ate these foods in Mediterranean countries, and looking at, was this correlated with risk factors for disease and that type of stuff. And then he noticed that, well, nobody simply isolated themselves off in the corner and ate those foods. Those foods were always eaten within a social context, with big preparation, with family and friends, lots of environmental cues and stimulants that occurred upon that, lots of celebration that usually went on, lots of socialization that went on. So he said, well, I wonder how much of these genes are turned on just by that. So he began to measure the gene expression in the urine prior to them even taking a bite. And he showed that many of the same genes that they thought were due to the food they were taking were turned on even before they ever took a bite, just through the preparation, just through the socialization in those areas. And so eating is not simply about the composition of the food. It's an entire social, emotional phenomena that that is conditioned in you from the time you're born, and even prior to birth in many cases.
Right, and then you tell the story of Maria, this woman who was diagnosed with, high prediabetes or the beginnings of diabetes, and she was incredibly motivated and compliant, but she was also the cook in the family of making sort of Mexican food, Latin American food, and came back 2 months later depressed because she had lost the connection to her family through food and celebration.
That's right, and that was an example. Of here's somebody that focuses strictly on the diet, but not the importance in their life. That was an example of someone who had used even diet. Okay, I mean, you can use any kind of therapy to do this, and if it's not connected to what's most important in your life, what matters in your life, then you're not attending to yourself as a whole person. Okay, her social and emotional and spiritual sort of flourishing occurred because of her role as the caregiver, as the food provider in her family. And so by disconnecting those things, you were actually dividing her into two pieces. And that's not whole person care. All right. So it's important. And I ask all patients in my practice, I start off trying to ask what matters to them, asking them what matters in their life, and then aligning their health behaviors using good evidence, as much good evidence as we can find, with what matters, so that there's a motivation and an alignment. So you have to pay attention to, we sort of throw out the phrase rapidly, but we seriously do it, mind, body, and spirit, right? And it means mind, body, and spirit, not just body, not just mind, not just spirit. All of those have to be looking in harmony in those areas. Let me tell you an example of a patient that came to me with chronic back pain, 20 years of back pain, older guy. He'd been through multiple surgeries, injections, etc. And he came in to see me to do a holistic or an integrative health visit. The first thing I asked him is, I said, why do you want to get rid of this pain? What's the most important thing? What would you do if you didn't have the pain? And he said, oh, that's easy. The most important thing in my life right now is being able to get down on the floor and play with my young grandchildren. Okay? That is what I would do. And so we said, all right, let's see if we can get you to do that. So I took him up to the physical therapist, and we worked out a regimen where he could begin to work on his core musculature to get up and down off the floor. Now, we weren't treating his pain. In fact, it was very painful for him to do that, okay? But he worked at it because now he knew he was doing something that might help him get connected to something that was most important in his life. So he worked it, he worked it, he worked it, he worked it. And it took him about 2 to 3 months, okay, to really build that up, because he'd had some severe, chronic pain and dysfunction, and his body had been, surgerized and things like that. But after about 3 months, he called me up and he said, Dr. Jonas, I just got in my car. I drove the 5 hours necessary down to see my grandchildren. I got down on the floor and played with them. Thank you very much. That's an example. And his pain was better, okay? By that time, his pain actually got better, because now he's moving in a way through the pain towards what he wanted in life. And that actually aligned his therapeutic component and his medical treatment with his, what was meaningful for his life.
See, the first thing that went through my mind is when you said, I started by asking him, why do you want to get rid of this pain? I thought, like, doctors would feel like idiots asking that question. It's like,
nobody had asked him that before. They were just assuming that, and they were giving him things just to get rid of his pain. But they hadn't connected it up with the most important thing. So they hadn't been able to find what was the thing that he could do that could help his pain eventually, but was linked to what mattered for him. And this is the central aspect of what I call integrative health. Integrative health is the merger of conventional care with evidence-based complementary practices, non-drug approaches, and self-care. When you can get all three of those things together, that's integrative health, and that's the type of healthcare system we now need to develop. And the data clearly shows if you do that and you get people engaged, you improve their health, you lower costs, and you reduce side effects, and you improve quality of life.
Mm-hmm. Right. So we know about there's 3 prongs. There's the medical system, self-care, and these alternatives. Let's talk about the alternatives and complementary care for a while. You were the head of the Office of Alternative Medicine, I think in the 90s. So one of the things you come out swinging with in the book is that very few of these are proven to be better than placebo, right? So acupuncture, homeopathy, like most of these, like when you put them under the scrutiny of the randomized controlled trial, they don't wash out. And my assumption at that point was that you were going to say, we should not be using them. They are not proven. They're not standard of care. And yet you end up making the exact opposite argument. And in fact, pointing out that many of our drug treatments are no better than placebo, specifically, a lot of the psychiatric drugs. So what is the role of, certainly acupuncture can be cheaper than, $1 million machines. Certainly a lot of the alternative stuff has fewer side effects or benign side effects. What's the role of these, traditions from other cultures, from other mindsets in someone's integrative care?
Yeah. So don't get me wrong here. I love science. I've been doing science all my life. I taught science for many years to fellows at Walter Reed Army Institute of Research. We did science at NIH. I spent 15 years after I left the government running an institute that was focused on research and science around healing. And I think science is the best way to begin to sort out the wheat from the chaff, and also to build our understanding and knowledge, which is so important in terms of helping to make decisions. I also know it's a blunt instrument, okay? Especially when we get into the clinical science. We have so much tremendous knowledge about the biology of this and that we learn from breaking the body down into parts. But when we stick it back into the complex ecosystem that our body is, it gets pretty complicated and pretty messy. And so it's a blunt instrument. And so we utilize scientific knowledge to help understand how we work, but we have to also then be very cognizant of the complexity of the body when we apply it. So my argument is not so much against science. It's not. I love evidence-based medicine. I use it. I teach all my residents and medical students how to do it and the importance of doing it. But we need to pay attention to the way the body actually responds as a complex ecosystem. And there's an emerging type of science that I write about in the book called complexity science, which allows us to look at all the different factors together in a quantitative scientific way and begin to use those to trace and track the complex responses that go on. And I think this is the type of science that we need to use when we apply our knowledge in the real world, in the clinical components. And fortunately now, the scientific community is going in that direction. The NIH has something called All of Us, which is measuring all of a person, from the genes up to their social, economic, psychological, and mental factors. We're developing a personalized precision medicine, and I write about that in the book, where we can begin to measure what happens when you actually engage in behavior and lifestyle components. The microbiome is an example of that, okay? We know that the microbiome, the bacteria that are in our gut, influence many, many aspects of our health, including our immune system, and yet it's very complex. We can begin to measure that. We can begin to track that. We can begin to look at the toxicity components within our body. We can look at the optimal nutritional components within our body, and we can adjust lifestyle and behavior, not based on average, that from large studies in which the average response for people is this or that, but based on your personalized actual response to what's going on. This is the type of science that we need for a salutogenic or a healing-oriented integrative health type of medicine.
Right. And so when I think about that, I think about the way sort of subset analysis in medical trials has been misused for marketing purposes. Like, we're going to go in and our drug doesn't work, or it causes, suicidal ideation, but we're just going to keep looking until we find a group for whom it helps. And then we're just going to promote that as if it was the norm, where you're really talking about a subset analysis that's much more based on truth and ethics. How do we get there given our current economic model?
Well, we've got a dilemma, I think, in healthcare, in that 150 years ago, when we were dying from infectious diseases, when we were dying from the consequences of trauma, when we didn't understand the factors that went into prevention and to healing, we developed a science, a reductionistic science, an acute care-based science that really worked. It actually helped. In fact, it worked so well that we're not dying anymore, as often at young ages, and we're living to be old ages, the aging population, because that type of science actually worked 150 years ago. And for those types of conditions, it's fantastic. We would not want to get away with it, do away with it. If I'm having an acute heart attack, or if I get in a car accident, I want to go to the emergency room, and I want you to put that stent in to save my life, right? In those areas. And that's great for the acute care type of an approach. But it doesn't work in the complex chronic disease multifactorial component. In fact, we know that there are multiple ways and multiple factors that both influence the risk of disease, but also enhance our own health. And so that gives us a smorgasbord of opportunities to actually enhance our health. There's multiple ways to do it. And I've tried to break it down to 4 main categories: the physical environment, your behavior, your social and emotional life, and then your spiritual and mental life. And if you simply ask questions, and this is what I do with my patients, about that in your life, okay, you are actually taking care of the whole person. It's not everything in the world. It's just those 4 things. Sort of like Maslow's hierarchy. There's a core set of basic things that everybody needs to flourish. And we've now shown that not only on the psychological and social level, but we've even shown it now down on the basic biology of how our body is influenced.
Mm-hmm. Yeah. So, and the other thing that occurs to me is, I'm a member of a tribe, right? I'm the whole food plant-based tribe, or team Colin Campbell or whatever. So that we're, and there's other tribes. And when you're talking about this kind of subset analysis and personalized medicine, it has to break that down to some extent. So in the book that I wrote with Dr. Campbell, we use the metaphor of the 7 blind men and the elephant, where everyone's like touching a different part of the elephant and trying to describe the whole elephant in terms of their limited knowledge. And the problem is not that they only have limited knowledge. The problem is their allegiance to their to their own confirmation bias and the ego that gets attached to it. How do researchers and practitioners and clinicians and health educators get more humble in the face of the opportunity for this personalization, where we can say to one person, you should be 100% vegan and you need to eat some eggs because you're hypocholesterolemic, or how do we train people to be less attached to our ideologies?
How do you train people to be less attached to their own beliefs, right? That's a good question. I think it was Albert Einstein that said it's harder to change your mind than to crack an atom, actually, or something like that. And this is true. We get attached to our own particular beliefs. Well, we do need to be humble. There's no question about it. And again, I think science is the way to help us sort out the wheat from the chaff, as messy as it is, okay? I mean, it's very clear. If you look at all the diets that are out there, and we'll start with diet and then I'll go wider than that, okay? If you look at all the diets that are out there, it's very clear that the best current evidence for the healthiest diet, okay, is something called the Mediterranean or Mediterranean-like diet. And it is largely a plant-based, fruits, nuts, and vegetable, some fish and meat and that type of thing, healthy fats type of diet. Okay, there's no question about it. That has been tested in randomized control trials, not just observational studies where they've, looked at what people tend to eat and 100 other things that they do. And it's been shown to correlate with that. Now, there's nothing fixed about that particular diet. It's plant-based, okay? It's minimally processed, okay? It doesn't use a lot of foods that are, that are chemicalized, processed, added sugars, added fats, added salt, etc. It is definitely not high in red meat, okay? And I know that's an important area. In fact, it's mostly fish-based, okay, in those areas. And the amount of meat that it uses is actually fairly small. It's the vast majority of plant-based. And other diets are similar to that. The DASH diet, for example, the China diet that Dr. Collins wrote and everything, are all that component. We know that's the core basis of a healthy diet in those areas. And so that's the type of thing we should be moving towards. That's what the entire culture should be moving towards in those areas from a diet. When it comes to actual healing, we have to pay attention to what is meaningful for a person. And this was written about 20 years ago in the landmark work about how our healthcare system ought to operate. It was called Crossing the Quality Chasm. It was the characteristics of what make up a high-quality healthcare delivery system. And it said at the very beginning, put the patient in the driver's seat. It was the start of a movement we called person-centered or patient-centered care, in which the patient is in the center of the driver's seat, which means we have to find out what's meaningful, relevant, and can be done with them. We still don't do that in healthcare very well. We still have the experts that come in and say, do this, do that, and tell you what to do, rather than saying, what's meaningful in your life, and let me help you get there. And that's where your work, I think, is so important as a health coach, for example. I mean, you have been and advocated and are and done health coaching, which is very different than saying, I'm the expert, I'm telling you what to do. It's saying, you're in the driver's seat, I'm going to bring in and help you get to the point where you can engage in certain habits and behaviors that are going to help you flourish and help you heal. And so the new type of healthcare that we need is a team care in which health coaches are integral parts of that, and the patient actually is in the driver's seat, and they decide which avenue they want to start with. If the patient comes to me and they want to do diet fair, then we start with that. If the patient comes to me and they have problems in their social and emotional or social support environment, we start with that. If they come to me and they have a stress issue, major stress issue, then we start with that. Again, if they're ready to. And the health coach then, and me, along with the team, helps support them to be successful in that type of self-care, which is where the other 80% comes from of healing.
Right. And one of the most beautiful phenomena that I see and experience on a regular basis is if my client's in the driver's seat, they often call audibles and they change. Like as a person starts to move and exercise, and they'll come back and they'll report, I just walked my longest walk ever. I did 2 kilometers. Now they're a different person and they want different things. So whereas before, yes, the goal is, I want to lose weight. And you don't want to push them too hard on it because they feel bad about it because it feels like vanity. At a certain point, it's like, I have higher aspirations for myself than I did before. So the meaning can change as they come into alignment with what authentic human bodies are meant to do.
That's right. Well, you've said it. You've said it exactly, Howie. That's exactly right. You're really supporting them in their own healing journey, and the most important thing about that journey is being successful in a small goal in which you've actually been successful and you experience that success. Okay, because that then builds on your ability to have even more success before, and that's very different than being told what to do, right? It's experiencing that component, and so that's the proper approach to the management of both prevention and recovery from chronic illness.
So let's move into sort of organizations. So I first reached out to you because I heard you on Peter Bregman's Bregman Leadership podcast, and you were talking about sort of healthy organizations. And as you know, I as part of WellStart, we go into companies and our pitch is, we're going to save you money, you self-insured employer, because we're going to reduce the need for healthcare among your sickest employees. And so there's a way in which the marketer in me thinks we have to talk specifically about, well, what does an average diabetic cost per year? And if we get them to be pre-diabetic or undiabetic, what can we save? And to do just a cost-benefit analysis and make our pitch that way. But in your talk with Peter, you were talking about something far broader and deeper and more noble and more powerful about this idea of, like, where organizations are just trying to be not toxic. But you talk about, like, the purpose of an organization is to be a healing organization, and you're not just talking about hospitals and healthcare systems and medical practices. You're talking about computer companies and transportation companies. Like for you, that's not a bottom line, is that organizations need to be healing. That's not how business typically thinks about their mission. Can you talk about that, where that came from, and what what companies can do? Why, first of all, why should they aspire to be healing organizations?
Well, you've said it. Enlightened organizational leaders understand that when they care for their employees, that their employees are their most valuable asset, no matter what product they're producing. That their employees and the environment and the families that they sit in, when they flourish, then their employees will produce more and they'll have a greater return on investment. They'll have greater profitability. That's been shown over and over and over again. And organizational leaders that pay attention to that and see that then act in that way. They support their employees to flourish. And so this translates then into thinking about your organization not as just something that's going to have a gym somewhere or an incentive program that's going to try to get people to move, but actually to create an environment where they spend a huge amount of their time in one that they love, that they enhance in those areas. So you look at the physical environment, and are they exposed to the things that humans need? Okay, natural light, good food, the ability to move, a positive social environment, a meaningful work experience. All those elements then are going to make them enthusiastic about what they do and then give them the capability of actually doing it better. And that is going to translate to a flourishing organization, and that's going to translate to profitability and a good ROI. And so this is what an optimal working environment is. An optimal healing environment and an optimal working environment are aligned. And there's ways to do that. There's metrics that you can look at. There's assessment tools that you can do. There's sometimes very simple ways to set that up. And so leaders that are interested in that, they can actually make that happen into their entire organization. Yes, you might save a little bit of money if you get your very sick, high costly patients to a cheaper treatment, right? In those areas, because if you're paying for that, you'll be able to do it cheaper. But that's the tip of the iceberg compared to actual enhancing the productivity and the profitability of your company by enhancing the flourishing of the people that work for you.
So why is that such a hard argument to make in most places? So the pushback I get is of, I guess, three basic kinds. One is, we're not running a nanny state, right? So we're not going to tell people what to do. The second is, listen, we are really busy and I need my employees focused on our Q2 mission, which is to, increase customer retention. And that's what I want them to focus on that. And if you've got them focusing on breathing and meditation and reversing their diabetes and losing weight, they're going to be split. And I can't have them spending all that time on the other stuff. And the third is it doesn't work. Wellness programs don't work. They don't have any ROI. And so every time we go to speak to a company, we have this mountain to climb before we can even talk about what we do or how it might help them.
Yeah. So I think that those explanations, those arguments have to do with a specific misperception about human motivation. And that is that the best motivation is extrinsic motivation. That if I set up the incentives that sort of move them by giving them sticks or carrots economically, I'll give them incentives, for example, economic incentives to try to drive people in, that is actually what's going to produce long-term change. And that is wrong. Behavioral psychology has shown that it's wrong. You can use an economic incentive like a bonus or something like that to get people to start something, okay? But it is counterproductive to try to use that to get them to continue it. They actually don't continue it. that has to come from intrinsic motivation, which means that this is meaningful to me. It gets back to the meaning effect that we were talking about before. Yeah, this makes sense to me. This is something that I like. This is something that is connected to my life in other areas besides just my work. It's actually going to help me enhance my ability to care for my family, or I enjoy being with other people and that type of thing. Those kinds of intrinsic motivations. And so the studies that have said worksite wellness programs don't work, most of those are very narrow focused on trying to incentivize people externally, specifically around isolated behaviors, rather than looking at the whole person. And those get people to start, but they don't have long-term ROI because they don't sustain the process. Worksite wellness programs that are holistic, they look at the whole person, mind, body, social, spirit, and meaning that we just talked about, those actually do have a good ROI. They actually do produce improved profitability over investment, and they also tend to be cheaper, actually, because they're simple things that cultivate the joy and the meaning and the social positivity that occurs within the environment. That motivates people intrinsically to want to do the best, and that's what leads to long-term productivity and profitability.
It reminds me of some of the studies I was looking at and working on Whole about taking isolated vitamins,
right,
and finding out that it actually, increased the death rate from heart disease and lung cancer, whereas the holistic diet patterns that contain those vitamins prolonged life.
That's correct. And that's the issue of a reductionistic science, which gives you lots of knowledge about little parts and the care we have to take in saying, okay, therefore we can just stick it in to the complex ecological whole systems that we are as human beings and expect that to have the effect in those areas. Application has to be done by paying attention to the whole person. Knowledge can be generated by isolating a certain component, but then the application has to take into attention of the whole person to do that. And so that's a holistic approach, whether it's in your work, whether it's in a healthcare delivery system, whether it's in your life.
Mm-hmm. So you work with organizations to help them achieve this sort of healthy, optimal working and healing environment?
We do. The organization, I now work for a charity that supports and funds research in those areas. And I do work with organizations to help them get this conceptual framework and then begin to measure each of those areas. But there's great groups that do this. So one of my favorite is Envia. By Larissa McAllister, who actually this is her job. She has a PhD from Georgia Tech in optimal healing and optimal work healthcare environments, and she will come into an organization and she will measure all those dimensions that I just talked about and show how you can tweak them in small ways and then track, are they having the effect on the whole organization that you want. So for organizations that are really interested in that, they can contact me. I can give them the general framework, and then I can put them in touch with groups that then can really help them get into the weeds about how to do that in their companies.
Gotcha. So in terms of the research that your organization has done, that's the Samueli Institute?
Yeah, so I used to run the Samueli Institute, but now I oversee the health philanthropies for the Samueli Foundation. So that's the charity that looks at advancing whole person integrative care around the country and around the world. So there is a Samueli Institute now, a renamed Samueli Institute. It's at the University of California, Irvine. And what they're doing is that they're creating integrative whole person approaches for medical education at the university for all of their healthcare schools, running clinics and providing community service in those areas in the California area, and as a representative for other academic centers around the country and around the world.
Gotcha. So, so based on your research, what are the takeaways so far about how an organization can foster the health, healing, well-being, meaning, joy of its employees?
Yeah. So the key issues are to actually take the 4 areas of an optimal work environment that I've described. I describe them in the book, and Envia, Laura McAllister, actually has metric systems, and others have metric systems around that. Take a look at the physical environment first. The context and the place that you live stimulates what's going on. If you have birds singing like that in the background, it actually influences your unconscious. If you have natural light, it influences productivity. If you regulate noise, that actually improves significantly. Look at does your environment allow for movement? Does it allow for healthy foods? Okay. Easy to get, accessibility in those areas. Does it produce stress? Okay. Stress is a huge issue. It's been shown in the work site to decrease productivity. There are ways to alleviate that stress very simply by creating a positive work environment and allowing people to engage in safe, relaxing components that are not fearful. Is there a supportive social and emotional component? Are people talking to each other in authentic ways? Do they trust each other? That creates teams that work better together and don't interfere with each other. And then finally, why are they there? What are they doing? Even if they're sitting at a computer coding, how is it connected to the larger picture in life? Most people want to do something meaningful and help the world, okay, in some way. And if they can see how what they're doing is connected and having an impact on a larger environment, then they're gonna be more motivated, they're gonna be more energized, and they're gonna do a better job.
So for that last one, does that mean that, say, a company that's focused on its profits and its quarterly earnings is going to be inherently less connected to meaning than, say, a nonprofit or some noble social enterprise? Or can meaning be a smaller, more personal, less global thing?
You can embed meaning into any kind of an organization, profit or nonprofit, and I've seen very profit-driven companies that create a flourishing environment for their employees, and I've seen nonprofit companies that create a very toxic environment for their employees. And so the profitability is not really the issue. I think the short term versus long term is much more important than that. If you lose the long-term vision of the value of your own employees because of the short-term, next quarter commission, that's when you get into trouble, and that can occur in nonprofits and in for-profits, also. And so I think that's the key issue, is making sure to pay attention to the core aspect of what allows people to flourish, those dimensions that I've described, that everybody needs to actually find meaningful in those areas. When you embed those, then you flourish and you improve. I remember a story, I think it was from the Mayo Clinic, where a janitor who was mopping the floor gets interviewed by a reporter, and they're there at night mopping the floor, and they're going into patients' empty rooms where patients are going to be, and they're cleaning it and everything. And the reporter says, "Well, what do you do here at the Mayo Clinic?" And they said, "I create a clean environment so people can heal better." You didn't say I was just mopping the floor, right? So somehow that person realized that what they were doing was essential to keeping people alive, healthy, and flourishing, and they saw that connection to the larger environment. And I thought that was so insightful, in terms of how you create an understanding within a work environment that connects to the bigger picture.
Yeah, it reminds me, I think Dan Ariely had a story in his book Payoff about a custodian at a hospital who would make sure all the swinging doors were oiled so that the patients in the gurneys wouldn't get bumped. And
wouldn't get bumped, right.
He saw that as like his contribution to their healing, before and after surgery.
Exactly. Yeah, there's a great book called Conscious Capitalism. I don't know if you've seen that, but it's
John Mackey.
John Mackey, exactly, which really, I think, in many ways, really captures what we're talking about, and shows that the good and the profitable not only can go hand in hand, but they must go hand in hand if you want to actually have long-term, organizations that go from good to great.
Beautiful. So what are you working on now?
Yeah.
What are the projects that you're hoping to push forward?
Yeah, so I have three major things that I'm doing right now. One is that the Samueli Foundation has just given a large grant to the University of California at Irvine to recreate and reinvent their entire healthcare educational system, medical, nursing, pharmacology, and public health around a whole person integrative components.
Wow.
And so that is a 10-year effort to try to create a major academic health center that has integrative health as the primary driving philosophy around its education, practice, and research. So that's number one. Number two, I'm working with national organizations, the National Academy of Medicine. We just supported a meeting with the Association of American Medical Colleges, the medical schools of the organization of the country, to begin to talk about non-pharmacological approaches to healing and getting them embedded in healthcare delivery systems, mainstream healthcare delivery systems. And then the third thing that we do is that we look at cancer and can we improve the whole person approach to cancer? Can we make sure that we understand how the microbiome, how stress, how nutrition, how lifestyle influences and interacts with the immune system, with immune therapies for cancer? And we've just set up a Center for Integrative Immuno-Oncology to begin to do research in those areas, the I2O. And so we're fostering that type of effort.
Wow. I interviewed a while back Kelly Turner, who wrote a book, I think, Radical Remission, which she talked about, 9 factors that all these, remarkable survivors of different cancers had used. Only 2 of them were sort of material. Sort of food, the rest was all sort of mindset and stress and forgiveness and higher purpose.
We know so much now because of the investment in the biology and the psychobiology of cancer and the microenvironment of the tumor microenvironment. We have so much knowledge about what are called the hallmarks of cancer. There are 12 hallmarks of cancer that good hardcore science has actually discovered that we need to now begin to apply what we know about that in the care of cancer patients and get past the old paradigm of simply kill the cancer. Right. We know that in itself is not good enough. And immuno-oncology, the manipulation of the immune system, is really a breakthrough in our ability to work with that microenvironment so we really can take care of cancer patients in a whole person and holistic fashion. And there's no question that the next age of cancer management is going to be so superior to what the last 50 years have been. The quality of life, the improved survival, by integrating conventional cancer care with some of the whole person approaches that we've just talked about around the science of the hallmarks of cancer. We need to apply that science now and move that along. And so that's part of what the Samueli Foundation is trying to do.
And I love your approach to cutting edge science, because I read so many science books that are about, we're about to solve all of our problems, with gene therapies. And it's still sort of, I know you spent 20 years in the military. It's a military model of we are going to conquer the terrain, as opposed to what you're talking about with these personalized medicine, with information, with integration of we are going to create a flourishing ecosystem in your body, in your family, in your community, so that healing occurs naturally. We're aligning ourselves with nature rather than trying to dominate it.
That's correct. In the area of chronic disease, the magic bullet myth is actually something we have to get away from and pay attention to the whole person. We now have the tools and we now have the scientific understanding about how to do that. It's time to now actually make that reality for everybody.
Right. Well, right on. So the book, I'll hold it up here for people who are watching this on YouTube. It's called How Healing Works: Get Well and Stay Well Using Your Hidden Power to Heal. Dr. Wayne Jonas, it has been such a pleasure getting to know you on this call and to kind of bathe in your wisdom and kindness and compassion and passion for healing. So I really appreciate you taking the time, and I really appreciate the work you've been doing and continue to do throughout this amazing career.
Well, thank you, Howie, and thank you for having me on your show and for all the great work that you do also. It's great talking to you.
All right. Well, be well. I hope we'll be in touch.
Okay. Take you.
Okay. Bye-bye.